let me just give an introduction regarding what Ayurveda is before we go really into Ayurvedic medicines. Yeah, the Ayurveda is the Indian system of medicine that you might be already knowing. It's originated in India. I mean, there are a lot of mythology stories of how Ayurveda originated, but previously mainly there was no medical system as it is available or as it is existing right now. But there were certain people who were having much expertise in herbs. I mean, those herbal experts became doctors in the previous centuries. And basically, they were rishis conducting their own experiments in their small huts, studying about plants. Basically, they were learning about this medical science and also regarding herbs by basically two or three means. One is self-experience, meditation, and another one was by practice. One is Charaka, who wrote Charaka Samhita. He wrote mainly about general medicines like oral medication, panchakarma, and so on. Next is Sushruta. He wrote Sushruta Samhita. Even in the modern science, he's known as the father of surgery because he was having expertise in conducting cataract surgeries, to kidney stones removing and whatnot. And then Vagbhata, who wrote Ashtanga Hridaya. These three were the main, and they wrote their own textbooks regarding their own expertise. It included all the aspects of Ayurveda, starting from basic principles to anatomy, physiology, or how the body works, how the body structure is, explanation of diseases, how it manifests, what are the causes, what are the treatments. So the treatment aspect that they explained were basically of two types. One is Panchakarma treatment and another one was oral medicine. Generally for any disease as such, first Panchakarma treatment was the preferred choice and then it was followed up by oral medicine. Panchakarma treatment can be told as a way to detoxify the body or to eliminate the waste products out of the body. Various procedures like enema and vomiting therapy, purgation therapy, or causing loose motion in the patient to eliminate all the toxins from the intestines. So these were the things that were there. Yeah, present also same. See what there is a slightly change in the choice of medicines as of now, but the principles what they had laid out in those centuries, the same thing is existing even today. Maybe the Ayurvedic doctors today use X-rays or MRI scans or lab tests, blood tests, etc. on par with the allopathic students or allopathic doctors. Sorry, but the principles that we have in our mind or the way we study Ayurveda is almost pretty much the same as they had laid out. Even we Ayurvedic students study this Charaka Samhita, Sushruta Samhita, Ashtanga Hridayam only, along with the modern anatomy, physiology, etc. Because we need to understand, for example, diabetes. We need to understand the modern aspects also, as well as the Ayurvedic aspects, in order to explain regarding the disease to the patients in a better language. We have got syllabus. I know the BMS, that is Bachelor of Ayurvedic Medicine and Surgery, is having a 4.5 year syllabus. First year we study about anatomy, physiology, modern anatomy and physiology I am talking about. We also do dissection, human body dissection, as it is done in allopathic MBBS course also. Along with that we study Ashtanga Hridayam first part, that is called as Sutrasthana, and Ayurvedic anatomy, Ayurvedic physiology, and there is also a subject called as Padartha Vijnana, which is related to spiritual aspects, some aspects of spiritual things that an Ayurvedic doctor need to know. So we study all these things, and yeah, in second year we study about herbs and disease manifestation and how to make medicines, etc. And in third year we study about actual treatments and panchakarma, how to actually do it, and what are the things that to observe, and what are the side effects that we may expect, etc. So, and treatment wise in panchakarma and oral medicines. So same thing is existing even today. Over a due course of time, apart from these textbooks, many of the Ayurvedic experts that came about, like Bhava Mishra, Sharangadhara, two examples might be sufficient. Bhava Mishra and Sharangadhara, who were in between 12th to 16th century, they also wrote textbooks. Bhava Mishra wrote Bhava Prakasha. Sharangadhara wrote Sharangadhara Samhita. They wrote their own textbooks, and many people wrote many textbooks in century by century, and now we have got many textbooks to refer. So whatever the Ayurvedic medicines that are being manufactured in pharmacies are of two types basically. One is traditional Ayurvedic medicine, and another one is proprietary Ayurvedic medicine. This traditional Ayurvedic medicines means it includes these churnas, avalehas, asvas, aristas, kashayas, decoctions. So whatever you hear, for example, Chavanprash or Triphala Churna, you might have heard, all these are traditional medicines. So these are the medicines for which the formula is directly taken from the textbooks. Chavanprash, it is mentioned in Ashtanga Hridaya, also mentioned in Charaka. So we take the formula from there and we manufacture as per the formula. So whichever the medicines like Dashmala Arista, there is a whole range, it constitutes about 50% of the 50 to 60% of total medicines available in the market are traditional medicines, right? So formula is taken from the textbooks. From Charak Samhita, Shastra Samhita, whichever the Ayurvedic traditional textbooks are there, formula is directly taken and you copy and manufacture. Next is proprietary medicines. Proprietary Ayurvedic medicine means here we only formulate a medicine. Like the formula may not be present in the textbooks, but we take the herbs that are mentioned in the textbooks and we take it out and we make our own combination. For example, if I am preparing a cough syrup, I know that Vasa is a good expectorant, like it expels the mucus, infected mucus out. So I will add Vasa. Then Tulsi is good antiviral drug and antimicrobial. Then I will add Tulsi. The neem. So I will make a combination of, just to give an example, I will make a combination of neem, Tulsi and Vasa. These three drugs. And I intend to give it to children. So children prefer more of syrups than churna or tablets. So I make it in a form of syrup. And I give it a name, my own name. Say children's special cough syrup. For it, first I need to test whether it is really helpful. I conduct a little clinical study on set of students, and I note the efficacy level, and I apply for license. I means a manufacturing company usually does that, and I apply for license and I get the license for that. Then I can manufacture it and market it to the doctors. So the doctors prescribe the medicines, understanding in which cases it is useful, and they prescribe and it goes to the market. So these two are the main things: proprietary Ayurvedic medicine and traditional Ayurvedic medicine. And another one is simple herbs. Like we know that ashwagandha has benefits to relieve stress. Ashwagandha is also good antioxidant. Like it helps in anti-aging treatments in elders. After 40 or 50 years, they feel tired with small works, and they also feel little stressed, maybe because of increased responsibilities, and also ashwagandha is good. So we give ashwagandha capsule. So these single herb medicines are also there. So basically the origin of Ayurveda and its prevalence is there because of the textbooks or because of the expertise that was stored in textbooks in yesteryears. That system is again continuing. In the recent times, the research that is going on, that is also getting included or incorporated into the science of Ayurveda. So this gives a larger picture. And recently AIDS has come up. So we need to boost immunity. So I'm talking about mental stress and physical stress is known to cause diabetes or hypertension. So specific medication or specific targeting of stress by Ayurvedic medicines. So these new concepts have been coming up, and the science is growing gradually. Yeah, this research happens in Ayurveda on par with allopathy as well. Allopathic people, they conduct their own research, and we do our own research and come up with medicines. And see, if you take cricket, a bowler, For example, Zair Khan has his own specialty, like he swings the ball and he's medium pace. Mitchell Stark or somebody from Australian bowler, he's having good pace. He cannot swing the ball as Zair Khan does. So allopathy is there, or Ayurveda is there, or homeopathy is there, Unani, yoga. These are the main systems of medicines that are there. Each one is having their own set of beliefs and their own set of advantages and also disadvantages. So the main thing with the Ayurveda is that it is good in rheumatology. That rheumatology means disorders affecting the joints. We have got our own specialty and they have got their own specialty. Like if you compare allopathy with Ayurveda, allopathy has got good analgesic medicines like pain relieving medicines which you take and you feel relieved after say half an hour to 1 hour. They got good antibiotics specifically targeted towards particular microbes, and they have got this surgery developed. But I must admit that Ayurveda does not have a specific antibiotic as specific as them. But we have got our own system of medicines and our own specialties in which they lack. For example, we have got good medicines to boost liver functions. We have got good liver tonics which they do not have. We have got specific medicines to disintegrate kidney stones. I'm not competing with allopathy as such, but just giving it's a wrong statement to say that Ayurvedic medicines are low or having lower potency or take long time to act. Even in allopathic medicine, if you are taking anti-tuberculosis treatment, that's treatment for TB, it takes 6 to 9 months to act. So that doesn't mean that allopathy is slow in action. Disease-wise, it takes time to act for some things, and some things it takes less time to act. For example, for a cough, we got good medicines to treat cough which may relieve cough in say 3 to 5 days, which is very fast. And it's another statement that Ayurvedic medicines are not having any side effects. It's a utterly wrong statement, and they do have side effects. For example, simple example, if you take ginger, for example, ginger, it relieves cough and it's good for fever and whatnot, but it also creates some gastric irritation as well. So starting with this simple example of ginger, we have got other medicines, and each medicine is having an action and a side effect. It's bound to have any medicine in any system of medicine. So it's a wrong thing that Ayurvedic medicines are not dangerous, or they are very safe and they have this. They do not have side effects. They have side effects, and I always suggest any patient or anybody to always consult an Ayurvedic doctor, then only take medicines. I'm not making a propaganda for Ayurvedic doctors, but it's always best to consult a doctor before taking any medicine. Yeah. See, if cancer has got its own stages, right? Up to a stage when there's a stage in cancer called as metastasis, where the cancer's tissue or cancer cell, if suppose someone is having lung cancer, the cancer cell comes into blood and starts rotating all around, and it may, wherever it gets stuck, it grows there. Like lung cancer tissue rotates all around and goes to liver and gets stuck there, it forms liver cancer. Up to a stage, Ayurveda is really helpful to combat cancer. But as of now, at least if you ask me, my personal opinion, we do not have a very straightforward medicine that take this medicine and you will be relieved of cancer. We do not have medicines. But if on par with chemotherapy, or in comparison to chemotherapy, we have got good medicines to avoid further duplication or multiplication of cells, these cancer cells, to improve, to relieve stress. Stress is the basic precursor of cancer. That is the recent research which states we have got good medicines to relieve stress. So preventive aspect of cancer is taken care. And chemotherapy brings in a lot of side effects like hair fall, this skin goes like dryness of the skin, and the patient gets tired a lot of times. So we got good medicines to boost up the general strength of the patient so that he can tolerate chemotherapy. So there is no magic pill or magic a remedy for cancer in Ayurveda as of now, but we have got certain specialization in certain aspects in which a cancer patient can take benefit from us. A lot of research is going on. Like I think Uma Pharmacy or Unja Pharmacy has come up with a tablet called as Cruel for cancer, and Kottakkal Ayurveda Shala. They are also conducting a special research on cancer. A lot of research will be or taking place in different aspects of disease, including cancer. Of course, this Alva Pharmacy is a unit of Alva's Ayurveda College. The college has a research institute. It has got 11 postgraduate departments. There, different research takes place as part of thesis work or dissertation work for post-graduation in Ayurveda.